Good afternoon. My name is Crystal Howe, and I'm going to go ahead and start this presentation on mental health care and special populations. These are patients that we will see in the primary care setting and the needs that each one have, and a little bit of further information about their mental health. So first, we're going to go ahead and discuss elderly and the geriatric mental health. These are individuals 65 years of age and older. Mental health in the elderly, also known as geriatric mental health, it is a critical and complex aspect of healthcare that warrants significant attention. As populations age globally, understanding and addressing mental health issues among the elderly becomes increasingly important. This demographic faces unique challenges and vulnerabilities related to mental health well-being, which can have a profound impact on their overall quality of life. The most common mental health conditions in the elderly are depression, anxiety, and dementia, with 1 in 4 older adults experiencing one or more of these disorders. Depression does affect 7 to 10% of older adults. And the prevalence among those residing in long-term care facilities is even higher. One of the significant challenges in understanding the epidemiology of mental health in the elderly is the underdiagnosis and undertreatment of these conditions. Stigma, limited access to healthcare, and a misconception that mental health issues are a normal part of aging can all contribute to underreporting and undermanagement of these issues in the elderly population. As we all know, elderly individuals do have multiple chronic health conditions, and mental health disorders frequently can co-occur with these physical illnesses. This can complicate these diagnoses, so it's important to keep in mind the different ways that we can diagnose mental health issues in the older population. A concerning issue is the elevated risk of suicide among older adults, particularly men. Suicide rates tend to be higher in this age group, and untreated depression is a significant contributing factor. Mental health can result in substantial direct healthcare costs, including expenses related to outpatient care, hospitalizations, psychiatric medications, and psychotherapy. Many elderly individuals with severe mental health conditions such as dementia, they do require long-term care, either in a nursing home or home health care services. And it's often the family or other caregivers that are taking care of managing these patients when they are in the home. And this can all lead to emotional distress, increased healthcare costs for the caregivers themselves, and even job-related consequences. So how can we assess mental health in the older population? And these are just some of the different screenings that we can use to address issues in the elderly population. Some of them include the mini mental state examination, which is a widely used screening tool for cognitive impairment. It consists of a series of questions that we can use for cognitive function and assess memory, orientation, attention, and language. Lower scores indicate greater cognitive impairment. The geriatric depression scale is designed specifically to assess depression in older adults. It consists of a series of questions related to mood, energy level, and overall well-being. Hamilton Rating Scale for Anxiety is an assessment used to measure the severity of anxiety symptoms in the elderly. It includes questions about physical and psychosocial and psychological symptoms of anxiety. You have the clock drawing test, which is a simple test that assesses visuospatial and executive function. Patients are asked to draw a clock face with specific details. Impairments in this task can indicate cognitive decline. And of course, we have the PHQ-9, which does assess for depression. And it's more of the patient's answers that can kind of let us know what they're currently experiencing. So the DSM-5, it is a widely used diagnostic tool for mental health conditions. When working with the geriatric population, it is important to keep in mind the other challenges and characteristics of this population when using the DSM-5. And it should be used in conjunction with these other assessments in this population. As age-related changes such as a cognitive decline and sensory impairments can mimic or exacerbate other mental health disorders as well. And then we have the treatment and plan of these individuals. So you have medication management can be an effective way in managing various mental health disorders in the elderly, but should be used with caution due to age-related changes in metabolism and potential interactions with other medications. So it is important to follow the 2023 AGS-BEARS criteria, which can provide details on potentially inappropriate medication use in older adults. Follow-up appointments to monitor the effectiveness and address any side effects or interactions of medications is important. Psychotherapy is beneficial for many elderly individuals and can help address depression, anxiety, and other emotional and cognitive issues. Group therapy can provide social support and reduce isolation. Loneliness and social isolation are common in the elderly. It is important to encourage engagement in social activities and maintain connections with friends and family in this population. Physical activity is important in all age groups and has shown to have positive effects on the mood and also individuals, especially in the elderly population, should have a well-balanced diet and stay hydrated because dehydration can also cause confusion, which can also mimic mental health disorders. Promoting good sleep and hygiene, and the plan of care should consist of setting goals, referring the patient to psychiatry and psychologist counseling, choosing the appropriate medications, regular monitoring and follow-up, coordination of care, and referring to social and recreational activities. The plan of care should be flexible and responsive to the individual's changing needs. Regular communication with healthcare providers and ongoing support from family and caregivers are key to successful treatment in the elderly population. And so we're going to move on to the perinatal and lactating individual and the mental health that we need to make sure that we're looking out for in this population as well. So mental health during the perinatal and lactation period which is encompassing pregnancy and the postpartum period, is a critical aspect of maternal well-being and child health. The infant's health as well plays a role in this. The well-being of mothers during this phase not only affects their own mental health, but also has profound implications for the development and health of their babies. Depression and anxiety disorders are the two most prevalent mental health issues during pregnancy and the postpartum period. Studies suggest that approximately 10 to 20% of pregnant women and new mothers experience symptoms of anxiety or depression. 1 in 5 women will experience a mental health disorder during pregnancy or in the first year postpartum. Postpartum depression can occur within the first year after childbirth and can affect around 10 to 15% of new mothers. And these symptoms include persistent sadness, changes in appetite, sleep disturbances, and difficulty bonding with the baby. A majority of women between 40 to 80% experience what's known as baby blues in the immediate postpartum period, with symptoms including sadness, worry, and fatigue. And this is different than actually having postpartum depression. This is something that, symptoms normally last for more about 2 weeks and resolve without intervention with no progression in severity. It's just, a woman's hormones regulating to get back on track. And then substance use disorders, including alcohol and drug abuse, can also emerge or worsen during the perinatal period, posing risk to the mother and the infant. Healthcare costs due to mental health issues during pregnancy and the postpartum period can lead to increased healthcare utilization, including doctor visits, hospitalization, and emergency room visits, and admissions as well. The costs associated with diagnosing and treating these conditions contribute significantly to healthcare expenses. Complications can also arise during pregnancy due to mental health issues such as overdose and poor health habits, which puts a burden on the healthcare system. Children born to mothers with untreated mental health issues may also experience developmental and behavioral issues, which can result in additional healthcare costs, educational intervention, and social services. And that's something we'll talk about a little bit later when we go over adolescents and the pediatric population. Mental health during the perinatal and lactation period are very common and have significant economic costs. It is important to address the issues through early identification, intervention, and support, which we'll discuss in the next slide. So identifying mental health issues in the perinatal and lactation population is crucial for early intervention and support. And here are common assessment and screenings tools that can be used in clinical practice for this population. So we have the Edinburgh Postnatal Depression Scale, which is a widely used screening tool for postpartum depression. It consists of 10 self-report questions that assess mood, anxiety, and overall well-being. Higher scores suggest a higher likelihood of depression. And then you have your generalized anxiety disorder 7, or the GAD-7, which is a brief questionnaire used to screen for generalized anxiety. The PHQ-9, which can identify depression, and an interview with the patient can also provide valuable information about a woman's mental health, history, symptoms, and potential risk factors. Screening for mental health disorders should be done during pregnancy and at regular intervals throughout the first year postpartum. Diagnosing mental health disorders in the perinatal and postpartum time for a woman can be challenging due to the overlap in symptoms with typical pregnancy, such as mood swings and fatigue. So it's important to take these different things into account as well, especially when using the DSM-5 tool. Treating mental health disorders in the perinatal and lactation population requires specialized care that considers the unique challenges and needs of pregnant and postpartum patients. Psychosocial support can provide emotional support and is often the foundation of perinatal mental health. It is important to ensure that the individual feels heard, validated, and supported in this experience. Some of the different things that can be done is psychosocial support, psychotherapy, which can address anxiety, depression, and perinatal specific stressors. During a study consisting of 8 nurse-led home visits that addressed maternal and infant mental health with psychotherapy, the intervention found significant improvement in the mother-baby relationship and a decrease in symptoms of depression. Medications may be necessary for some individuals, but it's not the first line for those that are pregnant due to the effects that it could have on the fetus and breastfed infants. Collaboration with a healthcare provider knowledgeable in perinatal pharmacology, such as psychiatric provider or OBGYN or psychopharmacologist, is crucial for medication management. Studies show that 13% of all pregnant women are using antidepressant. A safe medication that has shown no birth defects in pregnancy is sertraline. Patients that were previously on antidepressants or anti-anxiety medications can typically remain on these medications depending on the pharmacodynamics of these, the medication that they are currently taking. Sometimes women may need a switch, and that can go back to, the OBGYN or psychiatric practitioners. Exercise, nutrition, sleep management, and self-care are important factors to discuss with the patient. And education is one of the most important aspects of a treatment plan from a primary care provider. Healthcare professionals should provide education and support to women to help them understand the challenges and changes that are experienced during pregnancy and during the postpartum period. Information should be provided on the signs and symptoms to look out for and the importance of seeking support, as mentioned previously. Creating a plan of care for treating mental health disorders during pregnancy and lactation involves a collaborative and individualized approach. It is important to set goals, determine the most appropriate treatment modalities, discuss medication options, and then also connect the patient to psychosocial and support resources, refer the patient back to her OBGYN, pediatrician, or mental health specialist that have more knowledge in these areas, provide education, and make sure to have a follow-up plan. Follow-up is very, very important. Now we're going to move on to the pediatric and adolescent and mental health care. Mental health in this population is a critical aspect of overall well-being and development. The mental health of children and teenagers has significant implications for their academic success, social relationship, and long-term mental health outcomes. If they're not managed when they're children, then they most likely will also have these things going into adulthood, which can make it worse as well. And according to the World Health Organization, 10 to 20% of children and adolescents experience mental health disorders, such as anxiety, depression, attention deficit, hyperactivity disorder, and conduct disorders are some of the most common ones. Many mental health disorders have their onset in childhood or adolescence, and early identification is very, very, very crucial. Physicians and nurse practitioners in primary care settings are often the first point of contact for these patients, and it is important for providers to know what to look for and have some evidence-based approaches for treating conditions in this population. Depression and eating disorders are more common in females, and ADHD and conduct disorders are more common in males, which is something to keep in mind. Exposure to adverse childhood experience is also something to keep in mind, such as trauma, abuse, or neglect, and can significantly increase the risk of developing mental health disorders in this population. Mental health issues in children and adolescents results in substantial direct healthcare costs that include expenses related to outpatient care, hospitalizations, psychiatric medications, and psychotherapy. It can also increase costs due to the impact it has on education, and patients may need special education services. It can put a burden on parents and caregivers related to seeking diagnosis and treatment for their children. These costs can include co-pays, transportation to appointments, and time off work for these parents. Youth that have untreated mental health issues are at higher risk of involvement in the criminal justice system, which has its own costs. Mental health in this population can have a huge impact on individuals, families, and society as a whole. And addressing these concerns through early detection, intervention, and support is essential not only for improving the well-being of children and adolescents, but also for reducing the long-term economic costs associated with untreated mental health. So now I'm going to go into some of the assessment and screenings for mental health disorders in this population. Identifying mental health issues is essential for early intervention and support. Various assessments and screenings are used in clinical practice, such as the Pediatric Symptom Checklist, which is a brief parent-reported questionnaire used to screen for emotional and behavioral problems in children aged 4 to 16. It assesses a wide range of symptoms, including anxiety, depression, and conduct disorders. Strengths and Difficulties Questionnaire is a widely used screening tool for children and adolescents aged 2 to 17. It assesses emotional symptoms, conduct problems, hyperactivity, peer problems, and prosocial behavior. The Columbia Suicide Severity Rating Scale is a tool used to assess suicidal ideation and behavior in children and adolescents and includes questions about suicidal thoughts, plans, and actions. And then, of course, the clinical interview is a way to obtain further information from the patient about their feelings, thoughts, and emotions. And it is a way to gain rapport with patients, especially pediatrics. When using the DSM-5 to diagnose mental health disorders in children, remember to recognize that children and adolescents may exhibit age-appropriate behaviors and emotional responses that can sometimes mimic symptoms of mental health disorders. So always consider age and development. Gather information from multiple sources, including parents, caregivers, teachers, and the patient themselves. When making diagnoses, it is important to pay special attention to developmental disorders such as autism spectrum disorder, which may be present alongside or mistaken for other mental health disorders as well. So then we're going to go into the treatment plan, which involves a comprehensive multimodal approach and takes into consideration their developmental stage, individual needs, and family dynamics. It is important to begin with a comprehensive assessment, which includes an interview with the patient, parent, or caregiver, and relevant school or healthcare professionals. Performing a comprehensive assessment can determine the diagnoses and treatment plan. So first off, one of the big things is psychotherapy. It can help the patient understand and manage their thoughts, emotions, and behaviors. Current evidence suggests that cognitive behavioral therapy is first-line treatment for the pediatric and adolescent population due to its efficacy and limited side effects. And then you have the medication management, and then CBT, which current evidence suggests that cognitive behavioral therapy is a great way to start with these patients. And then the medication can be prescribed if symptoms are severe or not adequately managed with non-pharmacological methods alone. Medications should be carefully chosen and monitored by a qualified child and adolescent psychologist or psychiatrist. The only FDA approved medication for the treatment of anxiety and depression in this population is duloxetine, which is a serotonin norepinephrine reuptake inhibitor. Studies have also shown selective serotonin reuptake inhibitors such as fluoxetine and sertraline are more effective and are considered the first-line pharmacological treatment of anxiety in pediatrics. Escitalopram has also shown positive results in pediatric depression and is recommended by the FDA as first-line treatment for children with depression. It is important to collaborate with schools to provide necessary accommodations, support services, and counseling within the educational setting to address academic and social challenges. Access to case management, community resources, and support groups can provide additional help for both the child and the family. Counseling services can help the patient cope with their mental health and add additional tools in their toolkit when needed to manage these conditions. As the provider, is important to promote regular physical activity and a balanced diet, as these can have positive effects on mood and overall well-being. Developing a plan of care for treating mental health disorders in children and adolescents should be individualized and involve collaboration with the child, parent, and providers. It is important to set goals, determine appropriate treatment modalities, medication management, and appropriate referral and follow-up plan. as all follow-ups are very, very important. Make sure to develop a safety plan that includes coping strategies and emergency contacts, especially if there's a risk of self-harm or harm to others. And now we are going to go into the LGBTQ and mental health. Mental health in this population is a complex and important issue. Members of the LGBTQ community face unique challenges related to their sexual orientation and gender identity, which can have significant impacts on their mental well-being. Research consistently shows that the LGBTQ individuals experience higher rates of mental health issues compared to their heterosexual and cisgender counterparts. And research shows these issues can include depression, anxiety, suicidal ideation, and substance abuse. These individuals do often face discrimination, stigma, and harassment due to their sexual orientation or gender identity. And these experiences can lead to feelings of social isolation, lower self-esteem, and increased mental health vulnerability. Some individuals also experience rejection or lack of support from their families, which can be emotionally distressing and contribute to mental health challenges. Transgender and gender diverse individuals can also face unique mental health challenges such as gender dysphoria, discrimination, and barriers to accessing gender affirming healthcare. The economic costs associated with mental health issues in the LGBTQ community include expenses related to mental health treatment, medical care for physical health issues exacerbated by mental health conditions, and preventative measures. Addressing these disparities is not only a matter of social justice and human rights, but also has economic implications. Investing in mental health services and support tailored to specific needs of this community can lead to better health outcomes and potentially reduce long-term economic costs associated with untreated mental health issues. Some assessment and screenings for mental health disorders in this population include the PHQ-9 and GAD-7. For transgender and gender diverse individuals, assessments like the gender identity, gender dysphoria questionnaire is very important, especially for adolescents and adults, and can help diagnose gender dysphoria and assess its severity. And given the elevated risk of suicidal ideations and attempts among this community, it's essential to assess suicidality. Clinical interview is a way to obtain further information from the patient about their feelings, thoughts, and emotions. It is a way to gain rapport with the patient. And then conducting mental health assessments and using the DSM-5 in the context of the LGBTQ individuals requires cultural competence, sensitivity, and a commitment to creating and affirming supportive environment. So what are the treatments for this population? Treatment for mental health in the LGBTQ population should be affirming, culturally competent, and sensitive to the unique challenges of these individuals. So affirmative therapy is crucial, where therapists are trained to understand and support the experience of an LGBTQ individual. Therapists should provide a safe, non-judgmental space for clients to explore their thoughts and feelings related to their identity. Evidence-based therapies, including CBT and dialectical behavior therapy, can help manage symptoms of depression, anxiety, and other mental health conditions. Support groups can provide individuals with a sense of community, validation, and the opportunity to share their experience with others who truly understand. Some individuals may benefit from medication. Referrals are important in the primary care setting for individuals who need a more qualified healthcare provider with experience in mental health. And as always, it's important to promote physical activity and a balanced diet, as these can have a positive effect on mood and overall well-being. Creating an individualized plan of care for the LGBTQ individual with mental health disorder should involve setting goals, collaboration between the individual mental health provider and other healthcare professionals. And then last is the immigrant and migrant worker in mental health and the challenges associated with this population. According to the International Organization for Migration in 2019, the number of international migrants has increased from 84 million to 272 million in 2019. Mental health in the immigrant and migrant worker population is a critical issue with far-reaching implications. Immigrants and migrant workers often face unique stressors and challenges related to their migration experiences, which can impact their mental well-being. This population experiences a higher prevalence of mental health issues compared to the general population, including depression, anxiety, post-traumatic stress disorder, and adjustment disorders. Migration itself can be a very significant stressor for these people, as individuals may face cultural adjustment, language barriers, social isolation, and discrimination that they experience in their own country. And many of these individuals have experienced trauma in their home countries, such as conflict, persecution, or human rights abuses. And this can lead to long-lasting mental health effects for these individuals. And then they also often face barriers to accessing health care, especially mental health care services in the United States, or, wherever they're migrating to or from, including these language barriers, lack of insurance coverage, fear of deportation, and stigma associated with mental health issues. Social determinants of health, such as employment conditions, housing instability, and limited access to education, can also exacerbate mental health disparities in this population. Family separation, a common experience for many migrant workers, can lead to feelings of loneliness and depression. Undocumented migrants often live with the constant fear of deportation, which can result in chronic stress and anxiety. The economic costs associated with mental health issues in this population include mental health treatment, emergency room visits, and psychiatric hospitalization. Mental health challenges can cause these individuals to miss work. They may also need additional social services and support to get housing assistance, legal aid, and food assistance. Addressing mental health disparities is essential, not only for humanitarian reasons, but also for economic reasons in the immigrant migrant worker population. And then, having the accessibility to mental health care services can lead to better outcomes. Some different assessment and screenings that we can do in this population is the cultural formulation interview, as described in the DSM-5, is a structured interview designed to gather information about an individual's cultural background, beliefs, and practices. It helps mental health professionals understand cultural factors that may influence their mental health. And then, of course, the PHQ-9 and the GAD-7 used to screen for depression and anxiety. When language barriers exist, it is essential to use trained interpreters to facilitate communication during assessments and screenings. Miscommunication due to language barriers can lead to misdiagnosis or inadequate assessment. Mental health professionals and primary care providers should receive cultural competence training to be aware of and sensitive to the cultural beliefs, values, and norms of immigrant and migrant population. Clinical interview is a way to obtain further information from the patient about their feelings, thoughts, and emotions, and it is a way to gain rapport with the patient. It is also worth considering conducting mental health screenings in a community setting in this population. especially where my immigrant and migrant workers congregate, such as community centers or workplaces, which can increase access to mental health care. Conducting mental health assessments using the DSM-5 in the context of immigrant and migrant worker populations requires a culturally sensitive and individualized approach. Recognizing cultural diversity and addressing potential barriers is essential for providing effective mental health care in these patients. And then the treatment and plan of care for these individuals consists of providing effective mental health treatment that is culturally sensitive and linguistically appropriate. Especially with those language barriers, you want to make sure that patients understand and, we're both understanding each other. Mental health providers should receive cultural competence training to provide therapy that respects and integrates the cultural background of beliefs and values of their patient. And providers need to ensure access to interpreters and the ability to translate treatment materials and resources into the client's language when possible. Family and community support are very important in these patients, and involving family can be beneficial. Support groups can provide individuals with a sense of community, validation, and the opportunity to share their experiences with others who understand. Some individuals may benefit from medication, collaborate with immigration legal services and social services to address legal and social issues that may exacerbate mental health challenges. Advocate for clients in navigating legal and immigration processes. Tailor treatment plans to align with the individual's cultural beliefs and preferences with respect. Referrals are important in the primary care setting for individuals who need a more qualified healthcare provider with experience in mental health. As a provider, it is important to promote regular physical activity and a balanced diet, as these can have positive effects on mood and overall well-being. The plan of care for these patients should include setting goals, ensuring language access, discussing medication management options, providing community resources, and regular monitoring and safety planning. And these are the references. And that is the end of this presentation. I truly appreciate each one of you and your time and viewing this. If you have any additional questions, please feel free to reach out. Thank you so much and have a great day.